Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 28, KALI PHOS-4. KALI PHOS for different tissues. Any degenerative disease with foul and offensive sanious discharge like Crohn's disease, ulcerative colitis, gastric cancer, scurvy with gangrene, etc. Bleeding from any part of the body where the blood is thin, blackish, offensive and does not coagulate easily. Anemia with all pervading weakness. To alleviate the pain of cancer for ricket patient who used to purge carrion-odor like stool. Carrion-odor like extremely obnoxious. Actually, it is called rotten meat. Rotten meat, smell from rotten meat is called carrion odor. For aged patient with withered extremities, in problems arising out of too much of sex indulgence or too much suppression of sexual instinct, KP can show a spectacular result. Just watch the images below. Gastric ulcer. Severe ulcer. This ulcer is not ordinary ulcer. It is type of ulcerative colitis or Crohn's disease like a ulcer that is incurable in modern medicines. Foot ulcer. Foot ulcer is note the ulcer's type. Actually, it is not ulcer. It is a gangrene. Gastric cancer. Clearly, you can see the position of gastric content. Gastric. The picture of the gastric. This picture is taken from some microscopic view that this type of instrument is usually used to see the internal structure of intestine. This is gangrene of any type, and septic scurvy. The septic scurvy. KALI PHOS for skin troubles. Skin dry and wrinkled. When smallpox assume malignancy, skin full of pus filled, deadliest eruption, itching and crawling sensation of skin, better from light rubbing, but itching cause soreness and chafing. Itching of thick skin, palm and sole. Itching and crawling over chilblains. Use cheap remedy with cane. This particular screen may be a repetition of earlier. Please remember. It may be sometimes it happens so that same thing is repeated, but it is not bad. It is not bad. You can don't take it otherwise. Maybe it is a copy of some other screen of some other part. Maybe, no matter. KALI PHOS for febrile symptoms. Any fever where disease attains a fatal stage arising out of septic condition in some organ of the body. Patient muttering delirium, high temperature, sleeplessness, pulse too slow or too fast, almost imperceptible. Natremur may come along with this. Profuse foul odorous sweat in intermittent fever, modified stage of typhoid, typhus, scarlet fever, exhausting plenty of sweat during taking food with debility of stomach. Note wherever KALI PHOS is there must be some foul odors and very much extreme modified condition of the patient. KALI PHOS actually the medicine of end stage of disease. Before going to date, actually, such a serious medicine it is. KALI PHOS for sleep symptoms. Sleepwalking, already I have noted, said somewhere else, somnambulism, hysteric yawning, stretching of limbs, too tired, feeling with extremities of stomach, emptiness of stomach, though do not want food. No, he doesn't want food, patient, but the feeling of emptiness in the stomach. Sleeplessness due to anxiety, excitation, or any nervous reason. Note this is delirium. The patient is in delirium condition. Fever with huge sweat, sleepwalking, and yawning. Modalities of KALI PHOS. Generally works from noise, exertion, rising up from seated position. Again, situation worsen from continued labor, full absolute rest, and when alone. Mind the peculiarity. When he is rest, Hannah's continued labor, in both cases aggravation. But mind it, if he perform moderate labor, then there is no aggravation. It's better from light movement. Better from light movement. Mind this note this particular modalities. Better from light movement. That is, he is worse from serious, tremendous labor, tremendous movement. During eating, company of compatible person, pleasant excitement. Actually, KALI PHOS patients are cannot tolerate extremes of situation. Absolute rest, aggravation. Tremendous labor, aggravation. Moderate labor, okay. Absolute rest, aggravation. Moderate rest, okay. These peculiarities you must note. Guiding symptom of KALI PHOS, 5 star. I have given 5 star because these 5 symptoms, if you can get 3 of these in any patient, you can safely give him KALI PHOS. Want of KALI PHOS produces mental depression, nervous debility, hysteria, mental abnormality, delirium, chronic sleeplessness, even paralysis. In any element, excessive weakness, destruction of tissues of body like stomach, liver, uterus, urinary bladder, colposcopy. Mind is destruction of tissue of body of any type of tissue and any ailment. You forget about name. It may be cancer, it may be simple ulcer. In both cases, KP will be working. Number 3, diseases where exudation from natural, unnatural openings of the body are foul, reddish, blackish red, very thin, which do not coagulate easily, need KP. KP's exudation, patient of KP's exudation from a body is extremely foul. It is another very characteristic symptom, general symptom actually, so not characteristic. It is a permanent, fundamental symptom of KALI PHOS patients. KP is equally capable of tackling defect of motor and sensory nerve, both type of nerves. Subject of KP like sweet foods, ice cold sour drinks, they are averse to meat and roti. Life case. That day when I was about to close my chamber, an old aged person suddenly entered my chamber and started babbling. Doctor, I feel some uncanny feeling in my chest when I walk a little fast or a little more. I feel palpitation in my chest, I feel vertigo, cannot go to the sun, do not like to do my duty, at night I do not have any sound sleep. Again, if I sit or lie down quite alone, I feel unwell. Now the gentleman stopped to take air. I gestured towards him to sit on the chair nearby and then forwarded a glass of water. He gulped the water and heaved a deep sigh to say, Doctor, how nice cold the water is. It makes my entire body cold. And doc, he started again. These days I know that cold, sweetened lemon water have become my most favorite. Quickly I got my pencil, torch and examined his tongue. It was covered with brownish coating towards back, and when I drew my head near him, the foul smell of breath struck me. I thought that KP itself had walked up to my chamber. How long do you feel suffer? How long do you feel suffer from? About a year was his answer actually. I handed over to him KP 30x in half a dram file and instructed to take 3 tabs once in the morning for every 4th day for 4 times. Thereafter, once every 5th day for 4 times, so on till vial exhausted. He inquired, when should I come again? You won't need to come again, was my reply. And really the old man didn't turn up because the symptoms are so clear that KP will give him a new life. KP will give him a new life. And I have chosen 30x because he is quite a chronic patient. With this, the video ends. Please, thanks for listening and viewing. If any problem is there, please write down in the comment section. I will certainly reply. Many